Depression is not a weakness or a personality flaw. It's a medical illness that affects the brain and the body. Just as pneumonia affects your lungs or diabetes affects insulin levels, depression affects the way that the brain regulates your mood, energy levels, and motivation. Left untreated, it can have consequences every bit as serious as any physical illness, including, tragically, loss of life through suicide and rarely through hurting others in the belief that you're protecting them. Sadly, stigma and shame still stop many people from seeking help. Externally, society often sends the message that we should just toughen up, and internally people blame themselves, they feel weak for struggling and guilty. But depression isn't a character flaw. It's an illness that deserves compassion and treatment, just like heart disease and cancer. Acknowledging it and asking for help is not a sign of weakness, it's a sign of courage and strength. Recovery is absolutely possible. Antidepressant medication can be very effective, especially for moderate to severe depression. There is a lot of negative information out there in the media about side effects, but the good thing is that not everyone is bothered by side effects, and sometimes the side effects that a medication can have can be useful in treating or managing something else. There are also lots of different medications with different side effects, so you can work with your doctor to find one that suits. Just be honest with them, keep a note of any changes you notice, as it's usually very easy to sort out. Nobody wants you to suffer because of this. Medication is just one part of treatment. Therapy, like CBT, helps you to challenge unhelpful thoughts and habits, and when used with antidepressant medication will improve recovery rates. Exercise and time outdoors improve your mood and sleep, and keeping an activity or mood diary helps you see and focus on the positive and any progress you've made, because even small wins matter when you're depressed. There are also some exciting additional treatment options being made available to people, such as neuromodulation, for example, flow. These can be used to augment or instead of medication or therapy. If you've been feeling persistently low or are unsure whether antidepressants might help, then seeing a psychiatrist can be a crucial step. Psychiatrists can rule out medical causes and any other conditions that might be interfering with recovery or triggering the depression, such as heavy use of alcohol and ADHD. They can assess the type and severity of depression and create a tailored treatment plan with you, combining therapy, medication, and lifestyle support. So remember, depression is common, treatable, and recovery starts with reaching out. If this video resonates with you, please speak to your GP or mental health professional. You're not alone,